So perimenopause can be a very confusing and very difficult time for women. And I'd like to share with you how I work with my perimenopausal patients and what I do to help treat their symptoms and help make things a lot easier for them. The first thing that we do is start with lab testing. I want to know what your estrogen peak is during the first half of your cycle. I want to know if you're ovulating and what your follicular stimulating hormone is and your luteinizing hormone. I also look into thyroid and do a full thyroid panel looking for the thyroid hormones, the TSH, and the antibodies. I also check iron. I found a lot of cases of high iron or hemochromatosis or iron deficiency anemia that's really impacting how they feel energetically. I check B vitamin status, vitamin D, blood sugar, A1C, and insulin. And of course, because cardiovascular disease is the #1 killer for women, especially in menopause, I look at her lipid panel and her inflammatory markers like homocysteine and hsCRP, as well as apolipoproteins and Lp(a). After all that comprehensive testing is done, I review it with the patient and then we set a plan to move forward. So I then check in with her on what symptoms that she's experiencing the most. And it could be hot flashes, night sweats, weight gain, vaginal dryness, low libido. And oftentimes those symptoms are related to low estrogen. So even though she's still cycling every month and having a full period, she may not be making as much estrogen as she was before. In that case, I may give her a little bit of estrogen for maybe days 9 to 12 of her cycle to give her a little bit of a boost in the beginning of her cycle. Then we confirm if she's ovulating or not, which occurs in the second half of the cycle. If she's not ovulating, that means she's not making progesterone. And low progesterone symptoms are anxiety, insomnia, mood swings. So then we want to think about whether a topical progesterone in the second half of the cycle or an oral progesterone would be most appropriate. And depending on the patient, either may work. So I don't prescribe birth control for my patients in perimenopause. I don't give an antidepressant, and I don't just tell them to exercise and have stress-relieving practices, although those are very important. Oftentimes, those fluctuating and hormonal imbalances can make things very tumultuous and really impact quality of life for my patients. So we really want to get to the nitty-gritty of what's actually happening in your body.